Hello. Venous thromboembolism, or VTE, is the formation of a blood clot in a vein, and it is more common if you are a patient in hospital. This video will discuss how you can reduce your risk of developing a blood clot during and after your stay in hospital. There are two types of blood clot: deep vein thrombosis, or DVT, and pulmonary embolism, or PE. A DVT is when a blood clot forms in a vein, usually in your leg. The clot can get stuck and cause calf pain. In a small number of people, part of the clot breaks off and travels up to the lungs. This is a PE. A PE can reduce the amount of oxygen being delivered to the body. If the clot is large enough, it can result in death. Every year, 1 in 1,000 people develop a blood clot. A third of those people will die if the clot is not treated. Anyone can get a blood clot, but you are at far greater risk if you are unwell, immobile, and taking certain medications. This is why coming into hospital is a risk for many patients. There are things that you and your healthcare team can do to reduce your risk of developing a blood clot. Help yourself by mobilizing as much as possible and as soon as possible. A good exercise is to lie on your back or sit whilst bending and straightening your ankles quickly. By keeping your knees straight, you will help to stretch the backs of your legs. Drinking plenty of fluids. Wearing anti-embolism stockings or leg pumps if we advise you to. And taking blood thinning medications if prescribed by your doctor. This may be an injection into your tummy or thigh or daily tablets. Be aware that it is common to develop some small bruising around the injection site, but this usually fades quickly. Occasionally, you may develop an allergic reaction to the injection. You should inform your doctor if you notice a rash after injecting. Every patient who comes into hospital should be assessed for their risk of developing a clot. Depending on your level of risk, your medical conditions, medications and mobility, your medical team will decide what clot prevention treatment to give you. If you do not think you have been assessed or do not think you have been given any clot prevention treatment, speak to your doctor or nurse. Stopping clots is vital to a successful recovery, so don't be afraid to ask. You are at risk of developing a blood clot for up to 3 months after leaving hospital. To help prevent a blood clot, you should continue being mobile. Keep hydrated and follow your doctor's advice, even when you are at home. Unfortunately, some people still go on to develop a blood clot. You need to be able to recognize the signs of a clot so that you can seek help quickly. Signs of a DVT include cramps, aching, warmth, redness or swelling in your legs, especially in your calf, and pain on pointing your toes up towards the ceiling. Remember, these symptoms usually only affect one leg. Signs of a PE include shortness of breath, chest pain, which is often worse when you breathe in, palpitations, which is when you feel your heart racing in your chest, dizziness, or coughing up blood. If you notice any of these things, you should contact your GP or local emergency department straight away. If you have any questions or concerns about your risk of developing blood clots, please ask your doctor or nurse.